community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Hello, K-Man, and welcome to another episode of Healthcare Today with the HSA. I'm your host, Austin Harris. And just a reminder, Healthcare Today with the HSA is brought to you by Bobo FM every Friday and Saturday at 1 p.m. here on Bobo FM. On today's episode, we will be observing World Diabetes Awareness Month and chatting with our guests on the subject of diabetes and everything you ever wanted to know about diabetes but were afraid to ask. With us in studios, it is my pleasure to welcome clinical pharmacist and diabetes educator, Mrs. Winsome Jefferson, and she is joined by clinical dietitian, Mrs. Tamara Whorms-Riley. Ladies, hello and welcome to Healthcare Today with the HSA.
Hello.
Good morning, everyone. It's my pleasure to be here. I'm quite passionate about diabetes, so I'm really happy to be speaking about it today.
Fantastic. Well, maybe we hit the ground running and talk specifically about why World Diabetes Day is important, that we pause and recognize it as such.
It's quite important because diabetes is so prevalent in the world. Actually, there are over 500 million persons that are diagnosed with diabetes worldwide, and even in the Caribbean, roughly it's about 9% of persons in the Caribbean. So the persons in the Caribbean are high risk for diabetes. And World Diabetes Day is important to raise awareness about the impact of diabetes on people's health and highlight opportunities to strengthen the prevention, diagnosis, and treatment of diabetes.
All right. Well, thank you very much for that. And certainly the global statistics are frightening, but so too are some of the local statistics. As you know, we just recently had the STEPS 2023 National Health Survey published and in the public domain. And from that report in 2022, it says cardiovascular disease was the leading causes of death in the Cayman Islands, followed by cancer, unintentional injuries, and diabetes running a close fourth. And perhaps more startling, 1 in 20 of those surveyed were diagnosed with diabetes. Those are some startling and frankly scary figures
Yes, very high.
for the Cayman Islands. When we talk about diabetes, there are two common types, diabetes type 1 and type 2. Would you, Tamara, maybe explain to us what the difference is between 1 and 2?
All right. So what exactly is diabetes? So diabetes is a chronic metabolic disease characterized by elevated glucose or blood sugar, which can lead to, over time, to serious damage to the heart, because as you mentioned about the STEP survey, so all these things are intertwined, if I may add. So it can lead to problems with the heart, the blood vessels, the eyes, the kidney, and even the nerve endings. The most common types of diabetes would be the type 2 diabetes, which usually occurs in adults. And this type of diabetes is usually when it becomes more prevalent when the body becomes resistant to insulin or doesn't make enough insulin. And in type 1 diabetes is where normally it is called juvenile diabetes, but it has been, I would say, renamed over the years to be called pediatric diabetes. So the diabetes that usually occur in childhood. And this type of diabetes is when the body is insulin dependent, and it's a chronic condition which the pancreas produces little or no insulin for itself. So that's where most of the in terms of those type of diagnosis, those persons are provided with insulin. The fact is that persons with type 2 diabetes, if they become more and more insulin resistant, they may also have to be supplemented with insulin as well. However, it is more lifestyle related when it comes to type 2 diabetes, which means that your lifestyle is what impacts how this diabetes is, the condition is managed. So the more your lifestyle becomes healthier, is the better you can manage that type of diabetes.
So type 2 is lifestyle, type 1 is more
More autoimmune.
Right.
So it's something
That's
that
what I
you
wanted
cannot
to add.
really, it's
Right.
something that you cannot well, over the years, science have been trying to tell you exactly what can cause it, but it's more something that you are born with certain deficits.
so genetics.
Genetics.
Genetics play a role in type 1 as
It plays a
compared to
major
type
role.
2, which is lifestyle.
It
Ty-
plays-
yes.
yes.
All right, fair enough. Well,
And also, just as how you have autoimmune conditions, where basically the body will turn against the pancreas and destroy the cells that produce insulin, that's what happens in type 1.
okay.
And so they don't normally produce any insulin or very little. So they have to be on insulin for life, type 1.
I see. I see.
When type 2, your lifestyle is a big, is really very beneficial in type 2. And persons can take oral medications for most of their lives, or all for in most cases.
Right.
But some persons at the end, after having diabetes for many years, they might have to be put on insulin.
Right.
In type 2.
Indeed.
So,
When we think of common risk factors, that may otherwise predetermine that an individual may be, predisposed to have diabetes, on type 1, genetics is what you're born with. There's not much you can do about that, I would imagine. Whereas type 2, obviously, lifestyle, a great deal that one has to, control over. Talk to us about the risk factors that are associated with diabetes, or any trends that you have in your many years of, medicine discovered that are synonymous with diabetes, either type 1 or type 2, in persons.
okay, well, risk factors in type 2 diabetes. Persons who have it in their family line. So that there's a genetic component as well in type 2, in terms of persons who have their parents or grandparents who have diabetes. They are at a higher risk of getting diabetes, and especially the risk increases after 35 years old. And if persons, whether they have it in their family or not, and they have a big BMI, so they have a big tummy.
Right.
Right.
BMI, body mass index, yes?
Body mass index, right? So the waist is quite big, or their tummy is
Right.
big. It increases the risk
Okay.
of diabetes
Okay.
because it increases insulin resistance. There are some hormones that are produced when the food is being digested called incretin hormones, right? Which will stimulate the pancreas to produce insulin, to remove excess sugar from the bloodstream, and to make the blood sugar levels be controlled. In persons who have a big body mass index, those incretin hormones are either absent or the effectiveness of them are greatly reduced. And so insulin resistance is greatly increased, and so their chances of getting type 2 diabetes is greatly increased. Also, persons who are of the black race, persons who are of Indian descent, Filipinos as well, those ethnicities have a greater
Really?
risk of getting type 2 diabetes
I see.
as well.
I see. Tamara, anything you wanted to add?
Well, Yes, I'm agreeing with Miss Winsome based on the fact that she mentioned that your family history and your ethnicity plays a major role in the development of type 2 diabetes. And as she mentioned with ethnicity, I see that you perhaps were wondering, why is this so? Because when it comes to certain ethnicity, the BMI, the body mass index, the ratio at which we become overweight or obese or become prone to certain chronic non-communicable diseases like hypertension, cardiovascular disease, that BMI ratio is a little lower.
Right.
So it puts you at risk for other non-communicable diseases such as diabetes. And the fact is that when it comes to obesity, as you mentioned, as Ms. Winsome mentioned, most of when it comes, even as it relates to our ethnicity, black ethnicity, we carry most of our weight in our abdominal region. And because of that too, as you spoke about becoming insulin resistant, and that also put us at risk of becoming diabetic. And she mentioned that the diet as well, certain drug treatment, if you're on certain types of drug, Ms. Winston could talk about that. And then if you have polycystic ovarian syndrome, which I have a lot of patients who come to me with that as females, that puts you at risk for insulin resistance. And most times, Ms. Winston could also talk about that because they tend to have to put them on diabetes medication.
Right, metformin. Yes. Yeah, right. So as she had mentioned, persons who are on certain medication as well, we call it secondary diabetes.
Okay.
Right. So some persons who might have lupus or Cushing syndrome, and they have to be on steroids to control the condition. Steroids like prednisone or dexamethasone increases the risk of diabetes.
So would you say that diabetes could be a side effect of some of these different types of medications?
Yes, it can be a side effect of. It's not many persons get diabetes from that route,
right,
but it is quite a possibility. So persons who are on certain medication can get diabetes, and also you have gestational diabetes as well.
Okay.
Right. Some persons, when during the course of pregnancy, they can develop diabetes.
Really?
Yes.
And
many of them have to be on insulin during the course of the pregnancy. But in most cases, after the child is born, the blood sugar levels normalizes and the diabetes goes away.
Right.
But if that person doesn't change their lifestyle in terms of eating healthy foods,
yes,
and being active,
right,
they can get diabetes later on in life, which does not go away.
I am curious, and I know Tamara wanted to jump in, but I am curious that a woman who is pregnant can in fact develop diabetes during that pregnancy. And I wonder why that is. Is it because of the specific diet? I mean, I know being a father of at least one son, I remember the cravings that women have, and a diet is not a normal diet when pregnant is what I'm trying to get at. Is it because of is it reflective of those changes, or is it more so that the mother is really eating for two lives and therefore her intake may be increased and therefore the risk of diabetes is higher? I'm just curious.
What I have found, because I do a diabetes education clinic,
yes,
at the HSA, what I found is that many of those women have diabetes in their family life, in their family line. Okay. So there is still a large portion of genetics in it.
Right, so there's that autoimmune factor, type 1.
Not autoimmune, not type 1. No. Type 2.
Type 2 is lifestyle, type 1 was...
But type 2 has a genetic component as well. So persons who have diabetes,
right,
their children are at risk of diabetes, of type 2 diabetes.
Okay. All right.
Yeah.
Not a problem.
Yes.
Tamara, you wanted to make a point?
Oh, no, I was just agreeing with Ms. Winsome.
But type 1 is not genetic like that.
Right.
Type 1 is more autoimmune.
Okay.
But they have found that there's a particular gene that they found that gene in persons with type 1.
I see. Well, ladies, we do have to pause and take a short commercial break. But when we come back, more statistics from the STEPS 2023 National Health Survey as it relates to diabetes, and some key factors that those of you listening today might want to watch out for. But don't change that dial. There's a lot more conversation still to be had on Healthcare Today with the HSA and our guests. So keep it locked. We'll be right back for more right here only on Bobo FM.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
And welcome back to more Healthcare Today with the HSA and our guest in studios, clinical pharmacist and diabetes educator, Mrs. Winsome Jefferson, and clinical dietitian, Mrs. Tamara Whorms-Riley. And we are observing World Diabetes Awareness Month, and we're having a rather, certainly for me, I hope it is for you, informative and educational discussion on diabetes, the various types of diabetes, and of course things that we need to look out for or risk factors. Continuing where we picked off, we were talking, of course, about some of the findings contained in the STEPS National Health Survey 2023. And one of the things it talked about that 1 in 20 of those surveyed were surveyed to have diabetes, which we consider to be a startling statistic, but perhaps even more startling is another point that I think Dr. Gent made the last time he was on the program, is that a lot of those persons with diabetes go undetected because they haven't gotten tested for it, so they don't really know. So for those persons listening, what are some of the physical warning signs or symptoms that a person might be feeling or experiencing that might indicate to them that there may be a problem worthy of a visit to the doctor's office, specifically as it relates to diabetes?
All right, so some of the symptoms that people can first look out for, which would be like some of the more subtle ones at first, which is frequent urination. So you find that people may not drink a lot of water throughout the day, but they still feel like they want to urinate. There's always this conscious feeling like I want to urinate, so that can be a problem. Frequent thirst as well. So most times you feel thirsty constantly because the more you urinate, sometimes the more you feel like you're dehydrated, the more you get thirsty. And then another thing is that feeling more tired than usual. You haven't really done much for the day, but you still feel as if you feel sluggish, you feel lethargic, you always feel as if you want to sleep without doing anything that exerted you for you to be tired. You start to get thinner, you lose a lot of weight, and this is what we call weight loss that is on something that you didn't plan for. So unplanned weight loss.
Right.
And when you have that type of the type of scenario where you just lose weight without consciously exercising to lose weight, that can be a problem. I think that's a fair warning sign as well, that you should think about, why did I lose so much weight so drastically without formally exercising? And then the genital itching as well, thrush, where you start to have, for women it's more like yeast. The same thing with men, you can have genital itching as well. That can be a problem. Cuts and wounds that won't heal. Sometimes you get a simple cut and the expectation is that within days it should start to heal up, because you're producing blood cells and everything, so the expectation is that within a few days the cut should start to heal up. When that doesn't happen, that's when you need to go to the doctor to get checked. Blurry vision, your eyes are blurry, and this is one of the most common phenomena that people don't really pay attention to, because you find that this causes accidents. A lot of people, they will eat and their blood sugar goes up, they get blur vision while driving, and they can't explain why this is happening. And I think that should be a sign that you need to go see your doctor, because a lot of people are running into car accidents because of this type of blurred vision, not realizing that they may be having blood sugar problems.
Yes.
Right? And then increase in hunger. You feel hungry all the time, not understanding why am I so hungry, even though you may have eaten. And even with this hunger too, most times a lot of people are not craving the normal regular foods. The sweets, they got sweets. So basically, they are craving for more and more sweets.
Right.
And that's a problem. And then there is what we call the acanthosis nigricans, where the back of the neck just starts to get black. And you're wondering, why does it look so black, like a carpet kind of thing? And it looks more like what kind of skin we'll call it now, like a hedgehog kind of looking on the back of your neck. And that's something that if you see this in your young teens as well, because remember, something we didn't mention before too as well is what we call maturity onset diabetes in youth, where teenagers are becoming more and more prone to getting adult onset diabetes. Remember, one time it used to be adult onset type 2 diabetes, which is lifestyle related, as we mentioned before. So you find that more and more teenagers are coming down with this because of their choices, their food choices, and their lifestyle choices. Because remember, type 2 diabetes is not just about your food choices, it's about your whole lifestyle choices.
Indeed.
And more of those teenagers who developing type 2 diabetes as well, a lot of them are overweight.
Right.
Because the type 1 diabetes, which is only usually about 5% of the persons who have diabetes have type 1. But you normally find type 1 in children and young adults. But as Tamara mentioned, more and more teenagers, young people, are developing type 2 diabetes, which that is the one that is related to lifestyle.
I see. Right. Well, whether it's type 1 or whether it's type 2, let's talk about things that persons can do to lower their risk of developing diabetes. Now, I've heard that diet has a lot to do with it, but certainly is not the only thing that can be done. Talk to us about things that would otherwise lower an individual's risk of contracting diabetes.
All right, before we go on to that, I just wanted to mention something as well.
Sure.
Right. Now, why a lot of persons are not seeing the symptoms, some of the symptoms of diabetes, and going to the doctor earlier, is that diabetes causes persons to urinate frequently because the blood sugar levels are high. And so the body's saying, I need to get rid of the sugar, Right. And so they are urinating frequently. And because water is also expelled with the sugar in the urine, they are drinking much more water. And they're thinking, it's because I'm drinking so much water or fluids, why I'm urinating, why it is the other way around.
And these days they tell us we have to drink 1.5 gallons of water, a day. So, normally the thought comes to my mind, as you just stated, I'm going to the bathroom a lot because I'm drinking this pool-sized, bottle of water.
But one of the things that will happen to that individual, they'll get up about 3-4 times in the night and urinate.
Right.
So, that is a sign to look at because that is not normal.
Okay.
So even if you're drinking excess water, if your blood sugar levels are not excessively high, you might just wake up 1 or 2 times in the night.
I see.
So that is one of the things that persons need to look at.
And that's something that I must really agree with Miss Winsome on as well, because it is important to understand in science that when you urinate, as Miss Winsome mentioned, this is important. When you urinate, a lot of the sugar gets expelled as well. Right. So you will not some of the symptoms will go. And so each time you urinate, you get rid of some of the sugar, you feel good again. You'd feel like there is nothing happening. But as she mentioned, the frequent urination is what should take you to the hospital.
I see. All right. Well, again, thorough as always, and certainly do appreciate it. Before moving away from the question of symptoms or early warning signs, things that persons can pick up in their own selves, is there anything we've left out?
Well, what I want to mention as well, when patients having this fatigue and this tiredness, and they're urinating frequently, one of the reasons why they're feeling tired is that the sugar is in the bloodstream and not getting to the muscle.
Right.
Because how the body works is after you eat the food and it is broken down to sugar in the blood, the pancreas will produce insulin. And basically, the insulin will take some of the sugar out of the bloodstream, take it into the muscle cells to provide the muscles with energy, and into the fat cells to maintain the weight. So when you losing weight, is a sign that the sugar is being in the blood. It is not getting into the muscles to maintain the weight. And the same thing with the fatigue. So if there's fatigue, weight loss, frequent urination, and the blurred vision, and also being very hungry as well, the body feels as if it is starving. Because in many cases where you have, with the diabetes, with the insulin resistance, the sugar is remaining in the bloodstream, not getting into the cells to nourish the cells as it should. And so the body is interpreting as, I need more food, because the cells are not, the cells are not being energized with the sugar. It's not getting into the sugar. So it's good to look at things holistically, and if you are experiencing 2 or more of these symptoms, it's best to go to the doctor and get screened for diabetes.
All right.
Because it can really lead to serious conditions.
Okay. We were talking blurred vision, and Tamara, you mentioned that perhaps blurred vision may also play a role in the high number of vehicular accidents we've been having. And certainly when we look at the 2023 statistics for car accidents, over 3,000 vehicle accidents in the Cayman Islands in a single year. Now, whilst the police, I'm sure, will tell you that speed and alcohol played a role in the majority of those. The onset of this blurred vision, is this something that would just happen out of the blue, or is it perhaps after we've eaten, after we've had something to drink, whether it be alcohol or not? Are there any precursors or warning signs of the blurred vision that it might be coming on, or does it just descend upon you whenever it feels like it?
Normally, there is a precursor, and you mentioned quite a number of things there. First of all, when you eat your food and the food starts to break down, Ms. Winsome talked a lot about the food breaking down, going to your muscles, to give you the energy. If it doesn't go to your muscles to give you the energy, it's going to be floating around your bloodstream, and so that's how you start to feel more tired. So that is one of the first signs where you have eaten and you're driving, and you're feeling tired. So say, for instance, we're talking about you coming from West Bay and heading to East End. You just went to a party. You didn't even have much to drink or whatever. Shouldn't be driving anyway. But you've eaten, and you're starting to feel a little bit, like, why do I feel not woozy as if I want to sleep, but more like I have to be squinting my eyes more and more, and I've eaten like maybe say 2 hours or 3 hours ago. It means that, yes, the food has started to break down, but this could be more one of 2 things. It could be the fact that there's alcohol in your blood, and remember, alcohol doesn't just come with alcohol. Alcohol comes with sugars.
Sugar as well, yes.
And so you may have
Caribbean men like rum so much.
And especially so, you have a number of things going on there, and that's one of the main reasons too why it's not just about, yes, it is important not to drink and drive, but there could be so many factors that is playing a role into the reason you're feeling this way. So if you haven't even drunk anything that could cause you to be impaired, because we don't want to say you're drunk, because you shouldn't be around a car wheels if you are.
Yeah.
So there's so many factors that could play a role in if you feel impaired. However, as I said before, it takes a little while for you. If it is that is sugar that is floating around in your system, it's going to take a while for it to get to your brain and what we call your nerve, right, Ms. Winsome? So that could be something that you would need to look at.
Yeah, well, what I have found as well, working with some persons in the diabetes education clinic, some persons, their sugar might be elevated because, they're eating the wrong foods and that kind of thing. But after a while, continue eating, high-calorie foods, Miss Tamara will talk about food shortly, but eating high-carb foods that are high in sugar as well, the blood sugar level is continuing to be high and higher. There's a blood test that they do in the lab that is called HbA1c, which that lab test tells you what your sugar has been doing over the past 3 months.
Mm-hmm.
And when persons, and diabetes usually starts at 6.5. Now, what I have found, some of the persons who have come in with, and get admitted to the ward for blood sugar levels like over 400, 500, right? It was continually building up. So when the sugar is so high, it affects the eye with the blurred vision, and that lasts for a while.
I see. I see.
When the sugars get controlled, eventually that blurred vision goes.
Okay.
Right.
Okay. I see. Speaking of diet, and I think we've covered a number of these just in our general conversation, but again, going back to the National Health Survey, found that 85% of those persons who were surveyed eat fewer than 5 servings of fruit or vegetables per day. Now, I found that rather shocking when it seems to me that every one of my friends or associates, somebody is going vegan this week or next week, and they're all very health conscious. And eating more and more vegetables seems to be more of the norm, but certainly not from the National Health Survey standpoint. So when we talk about diet and changing our lifestyle and eating the kind of foods that will reduce our chances of getting diabetes, Ms. Tamara, how much does vegetables and fruits play a role in that well-balanced diet?
I'm looking at Miss Winsome and I'm smiling and I'm it's not just smiling, but I'm like, there's just so many emotions because just yesterday we had this health fair over by Cricket Square.
Right.
And if I should mention what all the people who walked up to me were saying, majority of them were saying, we want to eat more vegetables. We want to eat more fruits. But Mr. Mark, can you tell me how can you let me afford it?
Yes. Affordability is a very real concern.
So it's like when you mentioned that statistic to me, I was smiling at Ms. Winsome because I'm saying to myself, it goes hand in hand.
Yes.
We want it. People want to do it because they know. Somebody was saying to me that it's not a lack of understanding of how important it is and how the role it plays. And yes, it does, because remember, Ms. Winsome mentioned a little bit of it to say that, these things are lower in calories. They, for instance, when it comes to vegetables, they're not just lower in calories, they're lower in sugars too, most of them.
High fiber.
Right, higher in fiber. So basically, with that said, it is important that you know that yes, you need more of these things because they're high in fiber, lower in calories. Yes, they can help you to regulate your blood sugar levels, but we want you to find a way that you can incorporate it without thinking it's too expensive. So I usually tell people that if you can buy more of the blanched frozen ones. And if you want to get more information on what we call non-starchy versus low-starch vegetables, those are important in your diet. You can speak with a dietitian because those you would need to discuss in detail. But yes, it's very, very important in managing your blood sugar.
Fantastic. Well, I thank you very much for those responses and also, again, for pointing out the affordability factor in terms of how it impacts our diet. It's a very, very, very strong and solid and real observation.
I want to add one thing, though.
Yeah.
What I found, some children don't like vegetables, and some parents will say to me, because I talk about diet as well in diabetes education, not in as much details as Tamara. So what I would encourage persons to do is to start the children on eating vegetables from when they are very young. So even some adults say, I really don't like vegetables. I didn't grow up eating vegetables and I don't like it. So I want to encourage persons, start your children eating vegetables from when they are babies.
Okay. All right. Very, very, again, young parents out there or not so young parents, again, some very useful tips if you want to look after the future health of your growing son or daughter. We have to pause and take a very short commercial break, but there's lots more to come here on Healthcare Today with the HSA as we continue to observe World Diabetes Awareness Month, talking to you about some of the symptoms, the causes, the trends that may lead to either you're getting diabetes or, of course, things that you can do, changes you can make in your lifestyle to help prevent you getting diabetes. So don't change that dial. There'll be more healthcare today with the HSA still to come right here only on Bobo FM.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
And welcome back, K-Man, to more Healthcare Today with the HSA and our guest in studios, clinical pharmacist and diabetes educator, Mrs. Winsome Jefferson, and clinical dietitian, Tamara Whorms-Riley. And we are observing World Diabetes Awareness Month and discussing everything you ever wanted to know about diabetes but were afraid to ask. In the moments that we have left, we have to move swiftly along. I want to talk specifically about men, because also in November we're celebrating Movember. It's another one of the highlights of this month. And when we talk about diabetes and some of the ailments, some of the symptoms, if you will, that might otherwise indicate pre-diabetes, we talked about frequent urination, for example. And for men, all those young bucks under 50 years old, you can change the channel now if you like, but the rest of us need to tune in. You know, when you reach 50 years old, there's a thing called frequent urination at the wrong times, usually in the middle of the night, and we associate that with the risk of prostate cancer more so than we do with diabetes. But as we've learned, it could be one or the other. Maybe you can talk to that, using that as a catapult into symptoms that are specific to men that may indicate prediabetes.
All right. In men, well, everybody will have frequent urination.
Okay.
And to differentiate it with something that is related to the prostate, is that if you have frequent urination, being very tired, losing a lot of weight without, as Ms. Tamara mentioned, without effort of additional exercise and reduced food intake, and with blurred vision. So if you have several of those symptoms, it can point to diabetes. So it would be a good idea to get screened, to get tested. Unfortunately, for men, one of the things that can happen with diabetes is that it can lead to impotence.
End of the world. End of the world.
And I know that is a very serious thing for men, of course, right? The most
all Borden funeral, get fitted for coffin. Life is over.
Yes.
I digress. Continue, please.
Right. So persons who have elevated blood sugars over the years, it can lead to something called diabetic neuropathy, where the nerves that causes erection can be damaged, and so that can lead to impotence. Of course, there are several persons who don't even know they have diabetes because they're not getting screened, they're not going to the doctor regularly, and as I said, it can be overlooked with the frequent urination because they're drinking so much. They're thinking that is drinking a lot. What is leading to the frequent urination? So they're overlooking that sign, and even the fact that they're feeling tired or weak, they might still overlook that as well.
Sure.
Right. But of course, one of the things that can catch their attention is that they're impotent, and even though there are several other reasons that can cause impotence, I'm not saying diabetes is the only thing, only factor. But one of the things I want to encourage men is, if you're seeing several symptoms with frequent urination, you're feeling tired, you're always thirsty, you're always hungry, it is best to go to the doctor and get tested early, because there are medications that can control the blood sugar levels and prevent impotence from occurring that is linked to diabetes at all.
Well, I want to congratulate you. I mean, earlier on we talked about, diet, and, we talked about getting proper sleep, but if you did anything to encourage men to get tested today, was that last statement right there. Men are going to be lining up around the corner. Watch. HSA going to be busier than ever in the month of November. Let's talk about once a person has been diagnosed with diabetes now. What are some of the initial steps that they can take to manage what may very well be their new reality? We talked about type 1 and type 2. Type 1 meaning you're on insulin injections for the rest of your, not injections, but insulin medication for the rest of your life. What are some of the initial steps that an individual who has been diagnosed with diabetes can expect to take?
Right. So the first thing that you want to start is by looking at your lifestyle. What can I change in my whole lifestyle that could help me holistically? And one of the first things you want to do is to analyze your dietary practices. What am I eating? How is what I'm eating affecting me? And I usually tell people that you need to rate your plate. If you look on your plate and you yourself, you know. If you look on your plate and you know that afterwards I'm going to have any form of guilt about what I'm eating, it simply means that you need to change some of what's there. So look at how healthy my meal is. I usually tell people, if your plate doesn't look as if it may look beneficial to you, then it may not be a plate for you.
Really?
Right. If it doesn't look beneficial, then it may not be a plate for you at all. So that's one of the main things that you need to look at. So once you have heard the slightest thing, not just diabetes, if you've been told that you may be at risk, because I always tell people to start at Miss Jones, Mr. Jones, you are at risk.
Right.
Start right there.
Right.
So once you hear that, if you haven't heard yet that you have diabetes or you're pre-diabetic, but you've heard you are at risk.
Yeah.
Because look at your A1C today, Mr. Jones, Miss Jones. Sure. Look at your blood sugar test today. It's showing that it's trending upwards. I know, Miss Winsome, I've had those talks with patients as well. So once you get that first initial talk, you start to make those changes with your diet. And the second thing, you look at your physical activity level. Remember, you can start off slow, and then you can progress. Everything doesn't mean you need to run to the gym and go sign up for a gym membership. True. It means you could walk around your yard, start doing some gardening. Some people have leaves that may not be scraped up for a long time. True. So start with those simple things. When we say get physically active, we don't mean start jogging from West Bay to East End. True. We mean start slowly. Then the third thing is that you want to take care of your mental state. What is my mental? Because sometimes your mental health is the first thing that leads to you probably even developing diabetes in the first place. What am I thinking? What's going on in my mind that's making me eat some of the things that, I feel guilty about? What is in my mind that makes me feel so tired and lethargic all the time that I can't take a walk around my yard or in my community? What makes me feel so sluggish and just want to go home and sit down and put up my foot and don't talk to anybody? Right. So look at your mental state, and if you need to talk to somebody about that. Then the fourth thing you can look at, am I getting enough sleep? Because sleep impacts your overall health. It impacts how your body metabolizes food. It impacts how your day, everything that happens in your day. So look at how much you're sleeping and if you're getting enough sleep. And then if you need to reach out to somebody about managing all of these things like your weight and maintaining a healthy weight, then we have people who can help you. So those are some things that we usually look at to make it holistic. And if Ms. Winsome have anything else that she wants to add.
Well, certainly a very comprehensive list. And if I can just add one other thing as it relates to exercise, again, using, my own Mr. Jones, my mirror in front of myself, is that when people tell you, particularly as you get older, to get more exercise, and of course we think the usual, the gym, the walk and whatnot, sometimes the joints don't cooperate, but we have the luxury of living on an island. So you can include a swim as part of that. And of course, the water takes the place of gravity and therefore is a lot easier on those joints. Plus the added benefit of getting the vitamin D, and you talked about your mental state as well. Well, there's an old, viewpoint, I call it a myth or otherwise, but that salt water is good for the brain as it is for the body. Yeah. So again, you can incorporate swimming as part of your exercise regime, as Ms. Tamara pointed out. Ms. Winsome, something to add to that list?
Right. Quitting smoking is important as well.
Yes.
Quitting smoking can reduce the risk of developing diabetes by 30 to 40%. So it also helps as well, helps to prevent the complications after you actually are diagnosed with diabetes. And yes, the swimming I agree with. Sports, you can play pickleball,
Yes. Yes. Very popular sport.
football, walk. Just do more activity. Just be more active.
Indeed.
Right. And I want to mention something as well. In terms of healthy eating, incorporate more vegetables in your diet.
Right.
Cut down on the amount of starches that you eat. So the plate, typically, a good plate would be about at least 1/3 to a half of vegetables, about a quarter of starch, and about a quarter of protein.
Right.
And so what is important as well is the type of starches. Starches that are high in fiber tend to be much better because they prevent the blood sugar levels from spiking after you eat those foods. So even ground provisions like the sweet potato, green banana,
Yes.
yam, cocoa, cassava, those are good choices.
Yes.
Or even brown rice
Quite right.
is better than the white rice. And portion, as I mentioned, is so important.
Absolutely. And if affordability is a factor, as Ms. Tamara pointed out, I'm also a big believer in growing what you eat. So again, you can have a little backyard farm.
Yes.
Just, a little space is all you need.
Yes.
But if you can't grow it, don't eat it type thing, as the old saying goes. And there's a lot for the mental health in gardening as well. So you're
Yes.
covering all of your bases.
And even with the vegetables as well. One of the things that I mentioned to some persons that say, "Oh, vegetables are so expensive." One of the affordable way of eating vegetables is buying like the mixed vegetables.
Yes.
The frozen ones like the string bean, carrot, corn, green peas, so forth. Big bags of them can be just like $5, and you can incorporate them in your meals, and it will be good.
You get the side eye from the dietitian there. So
Yes.
I'm dying to hear what Ms. Tamara thinks.
Right, go ahead, Tamara.
I agree with her with the
But-
however, I usually recommend to patients if you are diabetic, try to buy the mixed vegetables that doesn't have the corn and the green peas in it as well, because it means that you're also adding starch there.
Aha.
Yes.
Okay.
So you can buy the rest of it, but try to buy, if you want to have some corn and
Yes.
some green peas, they sell those in the bag separately, where you can add those as a part of your high fiber starch that we would want you to have.
All right. Again, another reason why it doesn't hurt to pick up the phone and call a clinical dietitian, because what you thought seemed to be straightforward isn't always that straightforward. I thank you for that.
And you have some super vegetables.
Mm-hmm.
Okra,
Okra.
string beans,
Yes. Yes.
Brussels sprout,
Uh-huh.
bitter melon,
That's right.
asparagus.
You can find them all at your local farmer's market.
Yes, you
Ladies,
can.
we're running out of time. Can't spend all the time on vegetables. Let's talk about resources available. Again, we are fortunate in the Cayman Islands to have the Health Services Authority and access to wonderful professionals such as yourselves. But for individuals who are dealing with diabetes, either they have it themselves or they have a close family member who's recently been diagnosed with it, what are the resources available to assist those persons who are dealing with diabetes here in the Cayman Islands?
Okay, so at HSA, there's a diabetes education clinic on Tuesdays and Thursdays from 2 o'clock to 5:30. And appointments can be made through the general practice clinic, GP clinic, at 244-7520 or 244-7683. So persons can come and have a talk with me.
Okay.
And I can, my whole aim is to empower persons, give them the tools, what they need to keep their blood sugar levels controlled, to prevent the complications of diabetes. That can be very dire: blindness, amputation, kidney failure, heart attack, stroke. but those things can be prevented if we take measures, the eating healthily, being active, taking their medications regularly, going to the doctor, get regular checkup, monitoring the blood sugar levels. I can help persons
Okay.
with controlling their blood sugar levels.
And that number again was 244-7683 if you want to get a hold of Miss Winsome.
It's the that goes to the number for the general GP appointments
I see.
for the
I see.
diabetes
Yeah.
education clinic.
Okay, but then they can,
Right.
via that number.
So
they
they'll
can-
make that appointment for the diabetes education clinic through that number.
Excellent. All right. Do you want to leave a contact detail for yourself?
Well, yeah. I mean, you can also call the general HSA phone number, which is 949-8600, to be transferred to make an appointment to see any one of our dietitians, because there are 3 dietitians that does outpatient clinic. We have a dietitian that works in West Bay, Buddentown, GP. There's also myself who works in Northside, East End, Cayman Brack, and we also do community outreach programs as well. If you're doing your health fairs, if you want, talks in your schools, you can contact us. My number is 244-2663, and then you can also call Simone, which is 244-2655, or Mia, which is 244-7862.
All right. Ladies, that unfortunately is all the time we have for today. But I want to thank you both, Mrs. Winsome Jefferson and Mrs. Tamara Whorms-Riley, for the information that you have shared with our listening audience, the guidance you've provided. Ms. Tamara, you look like you want to raise your hand, like you want to say something. Like, I forgot. And say one more thing.
Yeah, because both myself and Miss Winsome, we wanted to say that November 14 is World Diabetes Awareness Day. And that is what we want to commemorate that day, so we can remember those who have lost the fight with all the complications and those who are still on the battlefield on that day.
And the theme for that day is breaking barriers, bridging gaps.
All right, indeed.
It's been my pleasure being here.
Thank you so much for being here, ladies. I hope I have the good fortune to have you back in studios to share more of your knowledge with our listening audience, but certainly to the audience who tuned in. We hope you have been edified by our discussion here on Healthcare Today with the HSA and our guests. Just a reminder to tune in every Friday and Saturday at 1 p.m. To learn more about the exciting services that are available to you at the Health Services Authority of the Cayman Islands. We never got to that. We just ran out of time, unfortunately. But there were 1 or 2 other questions that we wanted to get to. We just simply did not have the time. But again, it's just an excuse to have the ladies back in studios with us at another time. I'm your host, and you have been listening to Healthcare Today with the HSA, brought to you by Bobo FM.